I'm very excited that we're embarking on this journey together. And let us start with just talking a little bit about what TIST is. TIST came about as a sort of bespoke trauma treatment requested by 2 state hospitals desperate for a trauma treatment model that could stabilize very self-destructive suicidal patients who had been institutionalized for anywhere from 2 to 10 years. That's why they were desperate enough to call me. They were concerned because this was a group of patients who were very violent toward their own bodies, also violent toward staff. And the staff were fed up. They saw these patients as attention-seeking, manipulative, passive-aggressive, non-compliant. The toll on the hospital budget was enormous because many of them had to have one-to-one staff care 24 hours a day. Even in a locked institution, suicide and self-harm could not be prevented. I came to this project with the belief that self-destructive behavior in trauma survivors reflects survival strategies, particularly the fight response, instinctively mobilized when these survivors get triggered and feel overwhelmed by their emotions and their impulses. And many of them had no intention to die, but they had these self-destructive instincts. These patients had had years of what I call trauma-uninformed treatments. They had rounds and rounds of DBT, CBT, but those methods were not working, I believed, because the clients were structurally dissociated, fragmented, and internally conflicted, torn between wanting to be safe, wanting relief, wanting a sense of control, and wanting to feel okay. The other problem was that DBT had not had its desired effects because DBT skills have to be remembered. They have to be retrieved. They have to be applied during a crisis. But as the research on trauma and the brain shows, when trauma responses are stimulated, the prefrontal cortex goes offline, thereby interfering with the client's ability to remember the skills and use them. Their inability to exercise good judgments, to adhere to the safety contracts they'd agreed to, wasn't intentional as the staff interpreted it, but it came from that same trauma-related prefrontal inhibition. You don't remember your good intentions. You don't remember your good judgment. You can't retrieve it if your prefrontal cortex is offline. And the other premise of TIST, as I said, was that we had to understand these clients as fragmented, as structurally dissociated, and internally conflicted. And that would be the key to their making progress. Many models have been integrated to create TIST. You may recognize the work and the research of people like Bessel van der Kolk, Stephen Porges. The structural dissociation model is a theoretical premise that comes from the work of Anno van der Hart and colleagues. We draw on research on disorganized attachment and borderline personality disorder, and of course, this very important premise of Bessel van der Kolk's, the body keeps the score. TIST is an integration of models that are very valuable in and of themselves, but are even better when we integrate and combine them. The ingredients that you will learn, this is like the list of ingredients that your recipe calls for. We're going to work from a neurobiologically oriented understanding of trauma. We're going to focus on reinstating activity in the prefrontal cortex, because being able to remember and to use your own standard of judgment to be able to remember and retrieve skills is very, very important. There's a psychoeducational component, because I believe we have to educate our clients, not just treat them. And we reframe the symptoms and externalize them, because that gives the client some space between strong emotion and impulse. These ways of working are wonderful antidotes to shame and to trauma-related paranoia that so many of our clients suffer from. You're going to learn to use mindfulness-based skills, because those skills not only bring the prefrontal cortex into activity, but they also calm the nervous system and regulate emotion. And we're going to always bring to our work an assumption of organicity, the belief that the inherent intent of our brains and bodies is to adapt and survive. Even at their most self-destructive, the inherent intent is to adapt. As plants grow toward the light, human beings organically, I want to say, try to heal themselves. It's not conscious. It's not trying to heal oneself. There is that inherent tendency to heal, which we want to take advantage of.